That would be one initiative that I would absolutely encourage you to hit the accelerator with.
I like the next question, and I think it kind of is relevant to what you talked about. You talked about, how, uh, no coasting is something that you believe in, and all the successful people you watch believe in. And you also talked about the fact that COVID kind of put a pause on many practices, including your practice, when it comes to doing major initiatives. So the question is, in terms of major initiatives, can you name one project you have done at Life Smiles that has produced amazing results?
Oh, Naren, that's a tough one because I can think of I can think of many, but I want to answer the question. The doctor that wrote that question asked me to pick one. Um, Here, let me. I got to think for a minute. Okay, I got it. Um, One of the projects that I feel a lot of pride around in our practice is that we have over time really developed a state of the art periotherapy program for our patients, conservative periodontal therapy through our hygiene department for our patients. And I feel very, very proud about that. My hygienists have put heart and soul into that, Dr. Paul, Dr. Tim. I've certainly contributed to that. But, let's face it, periodontal disease is an epidemic in the US. It's an epidemic. Depending on how you measure periodontal disease, whether we count gingivitis or not, gingivitis should be counted, in my opinion. Um, Upwards of 70 to 75% of the adults in the United States have an active infection in their mouth. 70 to 75%. And if we're not serious about diagnosing and treating periodontal disease, all we're doing is cleaning their teeth, we're not really taking care of them at the level that they need. And today we know there is such a strong connection to your oral health to your overall systemic health. We know from science now that if someone has an infection in their gums, the infection is not just in that pocket, it's not just in their mouth, but in fact, the pathogenic bacteria is circulating through their circulatory system, leading to an increase in heart disease, stroke, diabetes. Among the women, early term birth, early deliveries, and certain cancers, oral squamous cell, and also pancreatic cancer. We also know there's mounting evidence that shows there's a possible connection to Alzheimer's disease, dementia, and fertility. So, we don't often think of dentistry as life-saving, unlike our emergency room physician colleagues. They're in the business of saving lives every day. Dentistry isn't often put in that context. But here is one where you could actually not only change someone's life, you could save their life by getting serious about diagnosing and treating perio disease. Naren, let's ask our team. We did a Thriving Dentist Show interview about why it's time and what to do to get serious about diagnosing and treating perio. This would be a great initiative to do as you're now getting off the brake and pressing the accelerator. This would be a great project to do. We'll put a link in thrivingdentist.com, and you can click that link and listen to that episode because it really gives you all the soup and, the A to Z, soup to nuts about what to do to get serious about diagnosing and treating periodontal disease. But that would be one initiative that I would absolutely encourage you to hit the accelerator with. And it's not an easy one. It's a challenge. But my grandmother used to say, Gary, if it was easy, everyone would do it. And anything worthwhile, is going to require some effort. So I'd put it around that concept. Anything worthwhile is going to take an effort and it's going to require an effort to do it. But that's the initiative that I would ask you to hit the accelerator on. Among others, but you asked me to pick one. That's the one that I've chosen. Hey, if you enjoyed this video, make sure to like, subscribe, and leave a comment to us saying I subscribed. Most importantly, be sure to click the bell button, which means you'll be subscribed so you won't miss out on any future videos.